Good evening. We begin with a special report tonight on the ground in Afghanistan, a country where millions of children are malnourished and where in one hospital 700 have died in just the last 6 months. It is a humanitarian crisis that deepens every day, with much of the country living in extreme poverty after years of war causing economic collapse. Well, the UN says more than 3 million children under 5 are malnourished, with the delivery of aid becoming much harder since the Taliban took over in 2021. Their policies, including restricting women working with humanitarian agencies, has only made a bad situation even worse. The BBC's Yogita Limai, camera journalist Sanjay Ganguly and producer Imogen Anderson have been in the country for the last 2 weeks chronicling the disaster, and Yogita joins us live now from the capital, Kabul. Yogita, you've been covering the plight of children in Afghanistan for the last few years. Is this the worst you've seen the situation, and what can make things better?
Well, this is definitely the worst I've seen, but I wouldn't say it was unexpected. It's caused by a multitude of factors, a significant cut in international aid, but also the Taliban's relentless restrictions on women since they've taken control of this country. The direct impact of that we've witnessed on the ground, and a warning that our report contains images of children in distress. This is what an average morning looks like at Jalalabad's main hospital. Hundreds throng every corner, every passage, as extreme poverty pushes more children into disease each day. Zara, 13 months old, one of 3 million malnourished children in the country. A disease that's ravaging Afghanistan's youngest. For every child here who's made it to a tiny bit of space in critical care, 4 others have not. At 7 months, Bibi Hajra looks like a newborn. Her mother Amina has already lost 6 children. It's like doomsday for me. My children are dying because we have nothing to feed them, she told us. Sharing the same bed is 3-year-old Sana. Her mother died while giving birth to her baby sister a few months ago. This is Ilham. He's 3, suffering from malnutrition and pneumonia. His sister died of the same diseases at the age of 2. In this one room, there were dozens of stories of death. Nasiba has lost 4 children. And now she watches as her baby girl Asma struggles for life. Her tiny body racked with multiple infections. By the time she was brought here, Asma was already in a serious condition.
It's like the flesh is melting off my body. I can't bear to watch my child suffering like this.
Asma went into septic shock. An hour later, she died. 700 children have died here in 6 months, at least 3 a day. We found out about the death of baby Asma when we came back to this ward to just check in on her, and what we can see in front of us already, in the half a bed that she left empty, there's another desperately sick child. This is baby Alia, 3 months old, severely malnourished and suffering from several other complications as well. And this is what it's like before anyone in this room, before the doctors, before the nurses have had time to register or recover from the loss of a child. Another baby has to be brought in because there are just so many of them in need. You hear the statistics, but this is what it looks like on the front line. A baby dies, a couple of hours later, another sick baby brought in. Over the past 3 years, we've been to dozens of health facilities documenting the crisis. Now, children are dying at a frightening pace from a lack of nutrition and curable diseases. Umrah has severe pneumonia. A nurse tries to stabilize her. The treatment available at this hospital is only possible because aid agencies have stepped in to fund healthcare since the Taliban took over. I'm extremely scared about what might happen to my child. I wish I was suffering in her place, Umrah's mother, Nasreen, says. 2 days later, Umrah also died. These deaths are being counted. But in the communities outside the hospital, children are dying silently. And there's also an underreported but alarming surge in stunting. It's affected a staggering 45% of Afghan children under the age of 5. Mohammed is 2, far shorter than he should be, and he cannot stand yet.
The doctor has told me that if he gets treatment for the next 3 to 6 months, he will be fine. But we can't even afford food. How do we pay for the treatment? I'm scared he will become disabled and he will never be able to walk.
Stunting can lead to irreversible physical and mental damage. In lane after lane, we see children at risk. It's in these communities where aid has been most dramatically cut. But where it is given, we find evidence of how it helps. 8-month-old Mujib used to be severely malnourished. His father, Sardar Gul, says the food sachets they receive have significantly improved his condition. And from back at the hospital, there's good news. Bibi Hajara was in a fragile state when we saw her. But with the right intervention, she's now well enough to be discharged.
Given those heartbreaking images, Yogita, one wonders what the international community is actually trying to do to improve the situation, because the Taliban ain't doing anything.
Well, Clive, so in the past 2 years, we've seen dramatic aid cuts to Afghanistan. The UK last year cut funds by around 50%, which has continued into this year. Other major donors like the US has cut funds as well. And what that has meant on the ground is that community nutrition programs in which health workers used to go to settlements and villages, giving food supplies to families, giving food sachets to little children at risk of malnutrition, that has stopped to a great extent. So the prevention, that's not happening. Even if you had excellent public health care, it would struggle to cope with the masses arriving. The solution to this problem lies in prevention, in community nutrition programs. That part can be solved by giving more money. Then there's the problem of the Taliban government. Donors do not want their money to touch the Taliban government. That makes delivering aid on the ground extremely hard. Then there are the increasing restrictions on women, a stringent law passed just a few weeks ago, which makes it extremely hard to actually give aid to those who need it the most, women and children. That's a problem that's difficult to solve, and at the moment, after the new law, engagement with the international community seems to have hit a roadblock as well. There is no easy solution to that factor.
Okay, Yogita, many thanks to you and the team for reporting for us from Afghanistan. Yogita Limai there.